Welcome to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we have a very interesting and very informative show scheduled for you today. And we're very excited to have two guests on the show. Tammy Taylor, excuse me, I just got a little dry here for a second, and Joe Kereley. And Tammy and Joe are from the Washington County Opioid Coalition, Drug and Alcohol Coalition, which I'm a part of one of the subcommittees as well. And they're doing such a wonderful job on educating people and treating people with various addictions. Mm-hmm. And there are some issues that occur because of attitude basically. Mm-hmm. I look at it as people that lack some knowledge and awareness. And so you develop these concepts, mm-hmm. and you attach those to people that are actually suffering with these addictions. And mm-hmm. in a sense, a disease.
Yes.
So you've been with the Washington County Drug and Alcohol Coalition for how long, Tammy?
Well, I've been with Washington Drug and Alcohol Commission for 20 years and been with the coalition since it formed. I believe that was in 2016.
2016. Mm-hmm. And I joined about, 8 months, mm-hmm. a year or so later. Mm-hmm. And what about you, Joe?
So I've been at the Washington Drug and Alcohol Commission for 5 years. I just recently joined the coalition a month ago.
Yeah, because they're actually two separate things. And would
mm-hmm.
you explain that difference?
Sure.
Either one of you can.
Washington Drug and Alcohol Commission is actually the single county authority in Washington County. We provide prevention, intervention, treatment services to individuals who are looking for and seeking drug and alcohol treatment. So we provide a wide variety.
So you're doing this through the county as employees of the county?
Right. We're actually a 501c3 nonprofit organization addressing the residents of Washington County. And then the Washington County Overdose Task Force was developed with our executive director and Jean Vitone from the District Attorney's Office.
And they've both been on our show. That's Cheryl
yes.
Andrews
mm-hmm.
and District Attorney Jean
right.
Vitone. And they're very proactive
very.
In the situation going on in the county, in Washington County.
Yes, very active.
And how did you end up joining the...
Well, honestly, I ended up joining it by default. The lady who was doing it, who was this certified recovery specialist supervisor, left the agency, and Cheryl Andrews came to me and said, "Joe, we need you to fill in," and I filled in.
Awesome. So you're a certified recovering specialist then?
Yes, sir.
And then your title?
Is prevention supervisor. I oversee the prevention department. So we provide services within the communities and school districts related to prevention of. We educate students anywhere from elementary all the way to senior citizens.
And that's the key to
yes.
what you're doing, and I think the key to the answer
mm-hmm.
to this problem that's going around worldwide, basically.
Yes.
Of course, we're focusing here on Washington County,
mm-hmm.
but we're actually setting the standard for just about every other county or every other state in the United States. The work that's being done with both the coalition
and drug and alcohol.
And drug and alcohol.
Yes, we can speak to the leadership of our executive director, Cheryl Andrews, and the work that's being done in Washington County through this collaboration and other collaborations addressing the opioid overdose issue, along with working with certified recovery supports, getting people into treatment, longer lengths of treatment, but most importantly, early education, doing the prevention.
So, in a broad view, are there certain ages that have a tendency to be more addicted to the drugs? We're talking about both illegal drugs and mm-hmm. people that become addicted to prescription medications.
Yes.
Well, personally, I think that your younger generation, your 18 to maybe 30s or 40s are using opioids or prescription medication or heroin. As you get into the older crowd, it's more of an alcohol. And we're seeing a shift in that in the county, where now the older population is starting to progress. For a long time, it was alcohol for that population.
And now it's switching over into these opioid medications like Oxycontin and
mm-hmm.
so forth.
Vicodin.
And what would be the reason for that, in your opinion?
In my opinion, I think it's overprescribed. Mm-hmm. And what I think happens is people go to a doctor, the older people go to a doctor because they have a pain and they genuinely need the pain medication, but then they take it for too long, their body becomes dependent, and the doctor says, you can't have no more. So when they're sick, or what we refer to as dope sickness or withdrawing from the opioids, they seek illegal street drugs, heroin, things of that nature, so they don't have to feel like that anymore.
And we're talking about people in their 60s, 70s, and 80s doing this.
Yeah.
Mm-hmm.
And so they have some type of surgery, or there's some type of injury, back injury, hip injury, or so forth, and they were prescribed painkiller, which some people need. There's no question about it. And then the body chemistry changes.
Yeah, we have often this. What studies are showing that typically it was early use, early initiation of use. However, there are studies now that are showing that an individual may have suffered some sort of injury. From that injury, been prescribed an opiate, and then turn into an addiction problem. So they are not necessarily somebody that has ever tried anything before, but then turns to that opiate as a result of the pain that they're, the injury or whatever.
And what a lot of people don't realize, medically speaking, one drug can impact you, for example, Tammy, and not have some of those side effects, or doing it for a week or 3 weeks doesn't make you addicted, but somebody else, and Joe takes one, and Joe could be addicted within a couple days.
Right.
So, and no physician knows that.
Right.
And the physician is prescribing it because you're obviously in pain, and I had surgery a few months ago, and I so much as don't even have an aspirin in my house. I'm a little over the top on this holistic approach to being well, and right away it was take this opioid, fentanyl. I go to the emergency room. We have fentanyl. No, don't give me any fentanyl. And they're like shocked because I was obviously in trouble and in pain. And
so, yeah, one of the great things about the Overdose Task Force and the work that they're doing is a lot of the things that they're doing. That's one of them. So it's really getting prescribing practices out to physicians, teaching them about what is proper prescribing practices. There's a lot of great things happening to address that. Pennsylvania's adopted a new prescription monitoring program, which allows doctors to make sure that an individual's not doctor shopping.
Well, it actually, I'll say this, it requires us to do that.
Yeah.
We actually have to go in, and then we have to log on, look at that patient's record, and log on that we're doing this, and see if anybody else has given it, because some people do shop opioids.
Yeah. So a lot of great things are happening as a result of the coalition.
Yeah. I didn't personally want to take them, and there are some things like tramadol, for example, which is a very powerful NSAID. NSAID. It doesn't have an addiction possibility.
Right.
You can't take it too long, because it's tough on your liver. But there are alternatives.
Yes.
But I think privately, Tammy and I have talked, and I said when I chose not to do any opioids. After that surgery, I came home and I was living on Tylenol and ibuprofen, and it really wasn't doing a lot for me.
It's not good for your liver as well.
Yeah, and it's tough on your liver and so forth. But with my condition, I could have a blockage on an opioid, which is a side effect that people don't talk about. You actually, it changes your chemistry in your brain, and it affects your intestinal tract, that peristalsis that we have, and people have ended up with colostomies because of opioid use.
I've actually seen a medication on TV, a commercial for that I don't remember the exact name. Have you ever seen it?
Yes, I've seen the commercial.
They run a commercial for a medication you can take in that situation if you're blocked up because of opioids.
Not addressing the opioid, but addressing the other issue.
Yeah.
So one of the things that we'd like to really talk about here too is the work within the coalition, the Stigma work group that Joe and I both sit on.
And that's the purpose we brought you on the show. I wanted to give the audience a little background on what's going on here, and why it's necessary to present this Stigma show. What's the definition of a stigma?
So, I mean, stigma, I don't know Webster's term, but I think it's anything that is going to hinder a person from getting clean or seeking recovery. It's a generalized opinion or a topic on a situation that we've just formed over time, and it's a hindrance to anybody seeking recovery.
So it's a attitude, basically?
Yeah.
Anything you'd like to add about
I would
that?
even say perception. Having addiction within my own personal family, and being a parent that was embarrassed somewhat to share with other people and within my family whatever that an individual was suffering. I think it's a lot of things to different people, depending if you're the individual who's suffering with the addiction, or even a family member. You don't want to share that. So I think until some of that's addressed and we begin to discuss it, we're not going to fix the problem.
So it's something that a person who has an addiction issue can put on themselves?
Absolutely.
Yeah.
I mean, we do it. I'm a person in long-term recovery, and then we do that. I mean, we apply the stigma of I'm never going to get clean, no one's ever going to help me, they don't care about me, and absolutely people carry that with them, and a lot of times it keeps them stuck.
It keeps them stuck. Absolutely, and that was the word that I was going to mention. So they're bound to their own issue.
Yep.
Because of what they think other people are going to think.
Yep.
What their perceptions are.
I'm an embarrassment to my family, or the doctor's just going to throw me out of the ER anyway, or no one cares.
Because a lot of people hide their addictions.
Yeah.
That are addicted.
Yeah.
And what they say, the first time you could ever become healthy or become well, whether that's physically or mentally, is to admit that you have a problem.
Yeah. I just had this conversation with a guy yesterday, and that was his exact question, was how long did you hide your addiction? And I said, buddy, there was no hiding it from me. But he had said, I hid mine for 20 years before my family ever knew that I used heroin. And he's still suffering. I mean, he was in a behavioral health unit. So.
And then the stigma that people in generally can put on that, what are those types of stigmas, attitudes, and perceptions that these people place on people that have a addiction
Well,
problem?
something we've learned from the Stigma Work Group, we recently did a countywide survey, and within that we're seeing that a lot of, for example, in naloxone, administration of the Narcan. They want to associate that, why are we doing it, all of these things, when Narcan in itself is a big help to the individual. So it's not that it's, something personally I hear it compared a lot to someone who suffers with diabetes. And what I always try to say is the Narcan is a life-sustaining device, much like the thing that would be used for you to bring you back from a heart attack. So it's not like it's medication to help you exist, but more so.
And that's I hear that a lot too. And we're going to take a quick commercial break here, but we're going to talk about that when we come back and actually explain what Narcan is, what it does, and why it should not have its own incorrect position there. What's the word I'm looking for? Perception. We'll be back in a minute on Healthy Pets, Healthy Owners with Tammy Taylor, Joe Kereley, and of course I forgot to announce that I have little Tucker here. He's been sleeping over here, so we'll be back in a minute. Welcome back to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and we're here with Joe Kereley and Tammy Taylor. This discussion we're having is fascinating because, as a medical professional, we're kind of taught these things, and we're actually taught to try to determine whether someone is, as I mentioned earlier, shopping for medications or and so forth, or somebody that might have some addiction problem, whether that be alcohol or drugs. But you do develop your own perceptions. Especially if you're not, someone who drank alcohol or experimented with drugs or whatever, and you develop these concepts in your own mind. So we're going to focus the last half of this show on what the stigma is, and what the anti-stigma part of the coalition, what the side of it, the committee that you head, and what you do. But we were talking about Narcan, and that one I think has a big stigma attached to it.
It does.
So would you explain to us what Narcan is?
So Narcan is a medication that it's administered at the site of an overdose. It somehow, I'm not a doctor, but it connects to the same receptors in the brain that opioids or opiates do, and it blocks them. So the individual, once they're hit with Narcan, if it's an opiate overdose, they immediately respond.
So what happens is if somebody ODs on taking an opioid, heroin,
never-know overdose,
OxyContin, any of those, it actually bumps that medication off the receptor. Receptor site is nothing more than, say, a sponge that just takes that medication in, or that nutrient or whatever. And this medicine, which is really inexpensive, knocks that off. And you can literally take someone who's about to die from usually respiratory arrest, knock that drug off the receptor sites, and they come back. So it's kind of amazing. But why is there a stigma attached to that?
So there's many reasons why the stigma is attached to Narcan. And the stigma is that you're saving people that aren't going to get clean. Why are we wasting money on these people that are never going to get it? That's the biggest one that I see, because you have, and even in the EMT world, you have EMTs showing up to overdoses of the same people, and I mean, it gets draining. I know it does. I do it. So that's the biggest one. The other one is people compare Narcan to EpiPen or a diabetes medication, and what they don't realize is the price of Narcan isn't set by the government or by me or you. It's set by the pharmaceutical companies that develop it. The guy who developed Narcan has nothing to do with the EpiPen. So that's a battle that I see constantly.
Well, okay, so let me give you a perspective here. I happen to have and require an EpiPen because I'm allergic to bees. That price of that EpiPen skyrocketed, like to the moon.
Yeah.
Several hundred times what it used to be. I have to pay for it. Why does someone who's drug addicted not have to pay for their Narcan?
But they do have to pay for it. While they don't pay out of pocket, I don't hand you my debit card or my credit card or my cash and say, thanks for saving my life, sir. But what happens is they get that hospital bill. I mean, the hospital bill attaches to your credit report. And I mean, when you get clean as a person in long-term recovery, eventually you want to clean up that credit report. So you're paying for that Narcan.
And again, the perception of Narcan is used as a life-saving device, much like the AFib is used to save someone.
Right.
It's for the purposes of bringing that person back. It is not something that is, something that is just being used as an ongoing thing. There's many perceptional things about people are having Narcan parties and all this other kind of stuff. As from what we've heard from, and I'm sure Joe can tell you, that's not what an individual who suffers with a heroin addiction is doing.
Because Narcan isn't creating a buzz, creating you to
That's
be
correct.
high or anything
That's
like
correct.
that. It's saving the life of someone who's taken too much of the medication or reacted to the medication.
And again, the work of the Stigma work group, the biggest thing we're trying to do is change the stigma associated, not even just with Narcan, but with addiction as a whole. That individuals who suffer with addiction, who get the recovery support services that they need, do recover and do become productive citizens of Washington County and everywhere.
And I think
recovery is possible, and
I
it
think
does
a
work.
lot of credit goes to the coalition and to what Washington County is doing with drug and alcohol. I mean, we have a DA that doesn't want to keep or put people in jail because they got hooked up on drugs. He wants them to have a quality of life and not be a burden on society and not to be a burden on the taxpayers. And the whole program is designed for that outcome.
Yes, there's many things in place. We have a treatment court, a drug court that happens under direction of our clinical director, Eric Kernow. We have an awesome judge that is helping with that, that's running that. Judge DeSalle. So there's many factors that are going into place to help and change a lot of what's happening in Washington County. Our overdose deaths are down dramatically.
In the whole state, Washington County is the only one that's down.
Yes.
And that's a result of this anti-stigma and the work that the coalition is doing.
Yeah, so there's, in addition with the Narcan, there's all of this training being done with first responders. I mean, there's just a multitude of things that are happening through the county. We welcome anybody that would love to hear more about that to come in.
So how do people do that, Tammy?
Well, we have on February 27th at 6 p.m. the coalition will host, we do quarterly open meetings to the public. So anyone that wants to hear more or find out more about some things that are happening can come to that meeting. It's at the Courthouse Square at 6 o'clock and again, that's February 27th.
Which is, I think, a Wednesday evening.
Yes, and they do hold those quarterly. They can reach out. Anybody could go to our website, Washington Drug and Alcohol website, and you can find out information there. There's information on Jean Vitone, our district attorney's website. So there's many things going on, and individuals who would like to know more or want to get involved can reach out and definitely find out more.
So the part of the healing and what the anti-stigma committee is doing, I don't sit on your committee, I'm on another committee,
Yes.
but what you're doing is actually changing the attitude of not only, well, first of all, the drug user, the person who has this addiction problem, and that's the biggest step into healing, because you're making pathways available for anyone who has an addiction, not to be afraid of the law, not to be afraid of the medical help. There's an avenue for them to come to and get that help and get the treatment and get back to a normal life.
There is, and that's why I think our certified recovery specialists do a great job. They don't always get the credit that they deserve, but these are people that are in recovery. These are people that have multiple years clean. They've been to the depths. They've dug their way out. So when you show up or I show up at the office, I can sit down across the desk and talk to someone on my level. It doesn't take away from a clinician or anybody.
It makes you relatable.
Yeah.
It
Absolutely.
makes them relatable to you.
You can sit down, you can open up, you don't feel judged, you don't feel unwelcome. You don't feel like there's a doctor sitting across or a clinician sitting across who really doesn't care.
Or you're going to get in trouble because
Right.
you're coming clean with your problem.
Right.
Yeah, it's amazing. And I have attended these meetings where you've had people come that have gone through this program.
To speak.
And I'm always amazed at the courage. On my radio show, Healthy Pets, Healthy People, I'm going to do a plug on AM 1250, The Answer, Saturday mornings at 9. We've had someone come on and talk about that, and the courage that it takes for someone that has gone through all of that to present themselves in the open like that, and to expose their heart and soul basically, but then to say where they are now, it's just absolutely amazing. I mean, I remember attending one meeting, Tammy, and the silence in the room was audible. That's how silent it was.
Yeah.
Because everybody was so focused on this story and the change in her life.
Yeah. We're very fortunate that Joe and his staff have helped with coming to schools, talking in schools about, what has happened and their path to recovery. We've been fortunate enough that we've used them in outlets at our monthly meetings, like you've said. So it takes a lot of courage, but only can stigma change when somebody can stand up and talk about that recovery is possible. That's where the real benefit comes. Yeah.
So
that's where we're going to make a difference.
So with the anti-stigma, you talk about prevention, you talk about treatment, and then you talk about perception and attitude. And often the families have a hard time because they've been dealing with it.
Yes.
And sometimes ashamed. Financial costs are great. I know that hits families pretty heavily. Some people have even lost their family members as a result.
Yes.
And they're even more embarrassed about it. But that's the whole purpose, is to change this perception, this attitude.
It's really educating because as a parent, like I said, enabling, you don't realize what you're doing when you're trying to protect. As a parent's instinct to protect, when in reality you're really doing more harm than good. But then it's the knowledge. I didn't know anything about addiction. I didn't know any of that stuff. So really being able to do the work that we do and educate, be the support services, and through the direction of our executive director, I think we're getting that round picture. I mean, I really feel the warm handoffs that are happening, having somebody in all locations, at the magistrates, at the hospitals, all of this, having these support services, helping those individuals to begin that road to recovery is so important.
You go to jail twice a week, don't you, Joe?
I do a group at the Washington County Jail twice a week. It's called Thinking for a Change. It's a cognitive behavioral group. It's pretty intense.
So what you're doing, and I think education is everything, and that's what we try to do on Healthy Pets, Healthy Owners. It's all about education. We do that on Healthy Pets, Healthy People because there's power in education.
Yes.
And then stigma, go ahead.
I was just going to say, not to mention, for every dollar you spend in prevention, you can save so much in treatment and healthcare related costs. So really early prevention, early education.
You take it as you become proactive as opposed to being reactive.
Yes, I love that. I say that all the time. Let's be proactive instead of reactive.
Yeah, and the whole coalition's, I think, attitude is
Yes,
that way.
I would agree.
And
I would absolutely agree.
Stigma does that as well. You're proactive in that you want to take and educate someone, whether they're the addicted person or a family member or a friend. Should I feel guilty if I know someone's addicted and I call the agency and say, do you think you can help this person? Should I have a problem with that?
No, you shouldn't.
No. But that's part of the stigma, is having a problem with that.
Yeah.
So how do people get a hold of the organization again?
So multiple ways, of course. Our website is wdacinc.org.
Okay.
They can call our 800 number at 1-800-247-8379. You can go, if you have Facebook, you can reach us on Facebook. So there's multiple ways that we can. We're located at 90 West Chestnut Street in Washington in the Millcraft building. We're on Suite 310.
Okay.
So.
All right. Well, it's the end of a show, and
thank you.
These shows go so
They
so
do.
fast, and I think the information is so powerful, and I appreciate you both coming on. So
Well, thank
Joe
you for having
Kereley
us.
and Tammy Taylor, wonderful job. Keep it up.
Thank you. Same to you. Thank you.
We try. We all try, and I think Washington County really needs to be proud. You guys and the people of Washington County, because you have a lot of volunteers that come
Yes.
in and do a lot of good work.
Yeah.
Thank you for watching Healthy Pets, Healthy Owners. We'll see you next time, and remember, a healthy pet is a happy pet. When you're healthy, you're happy too.